The University of Arkansas Medical Sciences wants you to know how it is supporting moms. That's why Dr. Callahan Koru, did I say that right?
Yes.
Yes, is here to share more. Welcome.
Yes.
Thank you very much. It's good to be here.
Absolutely.
Yeah.
I know we're talking about something that's very important. So fill us in. What is the Arkansas Perinatal Quality Collaborative?
So the Arkansas Perinatal Quality Collaborative is a network of hospitals that have committed to improving the quality of care and outcomes for their maternity patients. So we call it the ARPQC. It's coordinated by the University of Arkansas for Medical Sciences, but all of the hospitals that are participating are really equal partners in the work.
Yeah.
Okay.
How long has it been established? How long has it been a thing?
So we're actually in our first year of
Okay.
initiatives. So it was established in, we began working on building and setting it up about a year and a half ago, but we started our first initiative this July.
Yeah.
Okay.
And why do you think the collaborative is important for Arkansas residents?
So that's a great question. You know, giving birth and welcoming a new baby should be a really special time for a woman and for her family. But what we're seeing nationally is that an increasing number of women are having complications with their pregnancies that can lead to really serious health problems. And that's especially true in Arkansas. Arkansas is among the states that has the 5th highest maternal mortality rates. And so through the ARPQC, hospitals are committing to implementing national recommendations that can help put policies and practices in place that prevent and manage complications so that they don't become life-threatening.
Yeah.
Yes, absolutely. Can you tell us more who is participating? And it's called the
ARPQC.
Okay.
You got that right. So there are 37 birthing hospitals in Arkansas,
wow. Okay.
and 34 have committed to participate in our first initiative, which is to prevent unnecessary cesarean deliveries, which is 90%. It puts Arkansas among the states with some of the highest participation, which is really outstanding.
Sure.
We're also working with emergency departments to do obstetric emergency simulation training for their staff to help them be prepared to manage any pregnancy complications that come to them first.
Yeah.
Sure.
Makes sense.
Okay, so 34 out of the 37.
That's right.
That's a great number.
Yeah.
It is.
Yeah,
It's been
absolutely.
it's been a tremendous response. We're really happy with the
Yeah.
response.
Yeah.
Yes. And then what are some of the goals that you all want to accomplish?
So the overall goal of the ARPQC is to ensure that mothers and babies have a healthy start across the state. And then with each of our initiatives, that initiative will have a specific goal. So for our cesarean initiative, the goal is to reduce the cesarean delivery rate for low-risk births to the Healthy People 2030 goal, which is under 24%. Right now, Arkansas is at about 27% of low-risk births are by cesarean.
Yeah.
Okay.
And you said this was your first initiative?
That's right.
That's right. Yeah. So obviously you have others coming. How do you decide what initiatives you want to
Sure.
focus on?
So that's also a great question. It's really around what are the major contributors to pregnancy complications that we can address and improve outcomes for patients. So we know for reducing cesarean delivery rates is really important because when women have multiple cesarean births, they're at much higher risk for very serious complications in future pregnancies. So if we can stop the first cesarean by preventing it through different ways of managing labor, then we can set that woman up for a much healthier trajectory for future pregnancies that she has.
Yeah,
Yeah,
that's fascinating. Very
absolutely.
interesting.
Yes.
Well, how can mothers receive support right here in Northwest Arkansas?
So the Office of Community Health and Research at UAMS has a variety of free programs for mothers, for children and their families. And we have community health workers that are available to help anyone access essential health services. And you can learn more at uams.health/together.
Okay.
Okay.
That's the place.
Very interesting.
Are you seeing a lot of people who are coming to you saying that they need this, that they're excited about this? Or is it more about kind of raising awareness that it exists?
Well, we want everyone to know about the great work that Arkansas birthing hospitals are doing to participate in this collaborative.
Sure.
By signing up, they're committing to a lot of work to do quality improvement in their facilities and work with their patients and their providers to make sure that their systems are the highest quality care that can be provided.
Sure.
Absolutely.
So maybe as moms and families are looking for providers, that's something to maybe look for to see if they're one of the partners.
Absolutely,
Okay.
because you'll know that that hospital has made a commitment to ensure that they have the highest quality care. They're following the best practices that are out there.
Yeah,
Absolutely.
that's great.
Thank
What's the
you so much for
website?
joining us.
One more time, your website?
So for the Office of Community Health and Research, it's uams.health/together, and
Okay.
we have a forthcoming website for the PQC that'll be arpqc.org.
Awesome.
Okay, great.
Thank you so much.
Thank you so much for
Thank you for
joining us
having me.
today.
We
Yeah.
appreciate you.